It is possible for couples who are carriers of the sickle cell trait to not have a child with the sickle cell disease. Actually, there is no drug to prevent sickle cell, but there are procedures that can help to reduce the risk of having a child with the sickle cell disease. So those procedures is what I will be talking about today. The first procedure that I'll be talking about is the chorionic virus sampling, commonly called the CVS. So this test is carried out during pregnancy, about 9 weeks into the pregnancy. So what they do is that they just take a tissue from the placenta for the test, and the result usually comes out in about 2 weeks. So the result is not going to tell you if the child you're carrying is AA, AS or SS. It's just going to tell you in probability. It's going to tell you that, oh, this child has a high chance of being a sickle cell child, or has a low chance of being a sickle cell. So it comes in chances and probability. It will not go outright and tell you. So this CVS does not only test for genotype, it also tests for Down syndrome and some other genetic disease that a child could possibly inherit from the parents. The second procedure is a pre-implantation genetic test. These are majorly for people that do IVF. So, during IVF, the embryo is taken from the woman and the sperm is taken from the man, and it is fertilized. And then the fertilized ovary is implanted into the woman. So what they do in this case is that before the implantation, before this embryo is put into the woman, it is tested. So they test it. Normally they don't do one embryo, they do a lot of embryo during the IVF. So they test these embryos, and the one that have low chances of being a sickle cell carrier is being implanted into the woman. That way you are very sure that the child you are carrying is not going to be a sickle cell child. The child might be a carrier, which is AS, but you are sure that the child is not going to be an SS child. Other options for couples who are carriers of the sickle cell disease is to use a donor sperm or a donor ovary. What I mean is that since the both couples are carriers and they don't want to have a sickle cell child, or you should not have a sickle cell child, because this world is already hard enough to bring a child who is sick into it. So what they do is that you can use a donor sperm. So using a donor sperm involves collecting sperm from somebody else that is AA and then inserting the sperm into the woman, and then the woman becomes pregnant. And because the donor sperm is AA, there is no way the child can be a carrier, but there is no way the child is going to be an SS child. If the sperm is not going to be a donor sperm, it can be the embryo, the ovary. They can collect ovaries. Then in this case, it has to be an IVF. They can collect ovary from a lady that is AA and then collect sperm from the man to fertilize the ovary, and then they can implant into the woman who is a carrier. This way you are sure that the baby you are going to be carrying is not going to be an SS child. Another option for couples who are carriers of a sickle cell trait is to adopt a child. Yes, to prevent all of the issues that come with sickle cell child, even the child, considering the child, the pain and all of that. Instead, you can just go and adopt a child. There's already 1,001 children out there that do not have parents, that do not have who to live with, that are in orphanages. So it doesn't have to be from your lineage. You can pick a child from birth, or a child that is still very young, and raise the child to be your own. That way you can you can avoid having a sickle cell child. If you are couples and you both have the sickle cell traits, so these are options that you can explore so that you don't have a child that is a sickle cell, because that child will grow up not being happy, and you really don't want that for your child. So please watch this video again and again so that you can understand it. There are some labs that I know that does this genetic testing. One of them is genomics, and there are a lot of hospitals now, especially fertility hospitals. Yes, a lot of them do it. So you can walk into any hospital and make inquiries about them. Hey guys, if you are new here, my name is Jade. I talk about fertility because I hate infertility with all passion, because I have been there. I know how it feels. So I am here to help you get pregnant. If that's what you're interested in, I want you to subscribe, and I'll see you in my next video.